If you have asthma, or even if you don't, knowing how to properly use an inhaler is an important skill. Asthma is a respiratory condition that causes difficulty breathing. On the website, Allergy and Asthma Foundation of America, that was recently updated in June 2019, states that according to the Center of Disease Control, 1 in 13 Americans have asthma, meaning the chance of you having asthma or knowing someone that has asthma is relatively high. A rescue inhaler is a device that helps administer medication to those with asthma. It helps stop or prevent coughing, wheezing, tightness of the chest, or trouble breathing. Now, I know what you may be thinking. I don't have asthma. Why do I need to know how to use an inhaler? Well, the answer is simple. A lot of times when an asthma patient is having an asthma attack or difficulty breathing, they may not be able to administer their own medication. Therefore, if you know how to properly use an inhaler, you can help a friend, a family member, or even a stranger administer the medication, meaning you could save their life. Now, if you have asthma, you may be thinking, I already know how to use an inhaler. Well, according to Proverbs Health website that was recently updated in February 2019, a lot of asthma patients and inhaler users don't properly use their inhaler. This is done by either breathing at the wrong time, holding it wrong, or shaking it wrong. Now, don't feel too bad, because I myself have asthma and was using my inhaler incorrectly for many years. My name's Abigail Preventure, and I'm 19 years old, and I've had asthma all my life. Now, learning how to properly use my inhaler has allowed my asthma to get better, has allowed me to save my own life, and allowed me to save others. I have learned this through talking to many asthma specialists and also obtaining my CRMA. My CRMA stands for Certified Residential Medication Aid, which also required me to take a course on how to administer inhalers to other people. Now, I'm going to show you how to do so. The first step is to prime your inhaler. This is done if you haven't used it ever, or if you haven't used it in a long time. This is done by putting your thumb on the mouthpiece like this, and your index finger on the top to push. First, you shake it for 10 seconds, and then you spray it twice away from your face. This primes the inhaler. Now, if you don't need to do that, or you've already done that, the next step is to make sure that you or the person you're administering to has proper posture. This posture means your back is upright and your head is upright so that it can get into your lungs easily. If you try to administer it to someone lying down or lying down yourself, it won't thoroughly go into your lungs. Now, the next step after making sure your posture is right is to slowly move the inhaler towards your face while exhaling, like this. Once you completed exhaling, you place the inhaler in your mouth and your lips gently over, like this. Once doing that, you slowly begin to inhale and then push on the nozzle and continue to inhale, like this. After doing that, you want to hold your breath for 10 seconds or as long as you can, like this. Once doing that, you completely exhale your breath. This is how it all looks together. Once doing that, you do it for the repeated number of times your doctor recommends. If you don't know how many times the person you're administering needs it done, then you can ask them to hold up their fingers or tell you. In conclusion, knowing how to properly use an inhaler is an important skill. A lot of people have asthma, or you could have asthma yourself. And by doing it correctly, you can help save a life or make your asthma better. Thank you.